There was a study in Wales where at a certain date, people whose 70th birthday was before this date didn't get shingles vaccine. And then after that date, if their birthday fell after that date, their 70th birthday, they did get shingles vaccine. So it was a natural experiment. And in the group of people who got the shingles vaccine, and this is the old shingles vaccine, which is not as effective as the new one, the rate of dementia fell by about 17%. And it's thought that this was due to the prevention of shingles and that the chickenpox virus may have something to do with stirring up whatever it is that causes dementia, particularly Alzheimer's disease. So that was one piece. And the assumption is that the new version of the shingles vaccine, being even more effective, is even more effective at preventing dementia in the longer term. Now, this is a study looking at older Americans with very good health records, and they were comparing shingles vaccine with the new respiratory syncytial vaccine with flu vaccine. So in many ways, flu vaccine was the control here. And what they showed was really perplexing, is that not years after they got the immunization, so what they found was an effect of both the respiratory syncytial virus vaccine and the shingles vaccine, and not over years, but over actually months, lowering the incidence of what they expected with dementia compared to people who just had the flu vaccine. And so nobody's suggesting here that respiratory syncytial virus causes dementia or somehow at the root of this. What they think was going on was an additional benefit to the vaccine itself. And this is the substance that many vaccines have something, a chemical inside the vaccine or attached to it, which amplifies the immune response. It's called an adjuvant. And the RSV vaccine and the new shingles vaccine have the same adjuvant to stimulate the immune system. Mm-hmm. And what they think might be happening is that this adjuvant, it's not the vaccine, but it's the adjuvant that goes with it, somehow manipulated the immune system, which is what it was intended to do anyway for the vaccine, and affected the incidence of dementia, the underlying process of dementia.
Okay.
So this is over a large number of people. It's not proof of cause and effect, but it is an interesting finding. So there may be a double effect of the shingles vaccine, which is the chemical that goes with it, as well as the vaccine itself, and other vaccines too. And it might be a clue to treatments, and it may be even causes.